Welcome to another edition of NHIS in a Week. Now, the month of December has been declared NHIS Active Month. This year, the NHIA is launching a month-long celebration of activities to replace the NHIS Week that was hitherto observed for the past 4 years. The launch of the NHIS Active Month will officially take place in Tamale and will outdoor some groundbreaking innovations under the NHIS. In this episode of NHIS in a Week, we bring you highlights of activities that occurred in the Northern Belt regions ahead of the big launch of the NHIS Active Month. Now to our first story. The overlord of Dagbon, Yana Abubakari, has been named brand ambassador for the National Health Insurance Authority to help champion the activities of the NHIA in the country. Dr. Bernardo Kuboy, Chief Executive Officer of the NHIA, made the announcement when he, together with the board chairman, Dr. Ernest Kwaku, and some other members of the board and management of NHIA called on the Yana at the Bewa Palace in Yendi.
I want to assure the Yana and also to say that we have observed the influence that he carries in the kingdom and the whole of the Northern Belt and for that matter Ghana. We have realized that if we don't partner him, it will be difficult to convince everybody that the best way to get health is to register on the health insurance. So we are using this opportunity to announce that going forward, our own overlord is our own ambassador, father, brand, and everything at the National Health Insurance. You will start to see him on most of our programs as a champion of health insurance.
Yana Abubakari II, in acknowledging the new role, commended the NHIA for setting up the core payments committee to address illegal charges at healthcare facilities.
Honorable, your strategic policy interventions, including the setting up of the core payments committee to address the issues of illegal charges at healthcare facilities, is a major step in the right direction. The practice of illegal charges by the hospitals as a source of was a source of major concern not only to the people of the northern region but all Ghanaians. Your decision to stop the practice is a welcome news. In line with this, the upward review of the prices of medicines and tariffs to address the incidence of healthcare facilities refusing to give medicines to NHIS members because of complaints of low prices is commendable.
Moving on, a delegation made up of members of the board, management and staff of the NHIA paid a working visit to the Northern Regional Minister, Mr. Shani Al-Hassan Shaibu, at the Northern Regional Coordinating Council. During the visit, the Chief Executive acknowledged the immense contribution by staff of the authority in ensuring increase in enrollment.
Honourable Minister, our officers, as in our staff, within this Northern Belt, the 5 regions, have been very, very enterprising, very hardworking, and I'm pleased to mention that we are here so that they would even go beyond what they've been scoring when it comes to enrolling Ghanaians on the National Health Insurance. The best performance most of the time comes from Middle and the Northern Belt, or most of the time. I'm happy that my senior mentioned the innovative ways we are trying to adapt so that people will know and be part of the National Health Insurance. I say all the time that if you have an insurance cover which costs less than $2 a year, it means that when you meet someone who is not on the insurance cover, the reason cannot be financial, it is ignorance. Because the poorest person in this country, if he even gathers 1 peswa a day, will be able to afford $2 annually. So the real problem is not finance, but we carrying out the good news. And I am very much aware that that task is easier when we make all of you partners.
The Northern Regional Minister also revealed that the NHIS is part of the Regional Coordinating Council's Comprehensive Development Plan and is constantly in touch with the NHIA Regional Secretariat to work towards attaining high registrations in the region.
We have tried to make sure that the National Health Insurance is part of our development agenda. And if any one of you was following when I went to do the presentation about the northern region in the Meet the Press, the National Health Insurance featured very well in my address. Because if you look at the numbers that have come onto the table by way of registration, was almost double, and that was a plus.
Also, the Chief Executive, together with some chiefs and the DCE for Mion District Assembly, have officially inaugurated the Mion NHIS District Office for the people of the Mion traditional area.
The health insurance in this country is the best gift that Ghana has for all of us. So let's make sure that we get on the insurance. And because we don't want this gift to go away from you, that's why we are working hard to bring our brothers, our staff closer to you. Don't just get on the insurance and go to sleep. Tell your brothers, your sisters that they have to make sure they have health insurance. Very, very important.
At the inaugural ceremony, the CEO pledged his administration's support to make the Mion District Office fully functional.
I would like to make my comments very brief by reassuring you that this office will not be the last infrastructure you see when it comes to health insurance. We'll do our best to make sure that we support you in many ways to ensure that when you access health, you actually will experience the national health insurance that we are talking about.
Now to the Northeast region. The overlord of the Mambugi traditional area in the Northeast region, Nairi Na Buhagu Abdullahi Mahami Shirega, has called on Ghanaians to register with the National Health Insurance Scheme. He said this when the delegation from the authority paid a courtesy visit on him at his palace.
As for the overlord, been very passionate about health insurance. He has always encouraged people to do their best to register. So as you requested, it's something that has been going on, and you are now making emphasis. And the overlord will provide all the needed support that the institution will require to make health insurance a reality for everybody in Mambugu.
Dr. Okoboy, on his part, reiterated the commitment of his administration to always support the various regional and district offices of the scheme to assist their members efficiently.
We also have a job to educate people on how to live healthy so they don't fall sick, so we don't have to spend too much money paying for this. We have a job to educate. So before we can pay for your medical bills and before we can reach people to educate them, they have to be on the National Health Insurance Scheme. And there is no better person in the kingdom than the Nairi to tell everybody that make sure you are registered on the insurance.
While in the Northeast region, the NHI delegation paid a working visit to the regional minister, Honorable Yudani Zakaria.
Thank you for thinking about Northeast. A distant place, very new region, but so much attention has been given to us from the side of government and all other state institutions. So the success story, my brother Apetiga will write about the performance of the National Health Insurance Scheme in the region largely will be attributed to your good works.
There's a particular reason why I make sure regularly we visit regions in this country, including Northeast. We are what we are because of our staff. And no staff or no position or place in the country is too small or too big to affect our overall image. If Northeast alone decides to go to sleep, the whole organization will be in trouble. And so with this knowledge, Accra and Kumasi and Cape Coast is not the only place that will determine what we are. Northeast is also part, and that is why we, all of us, I mean board management, we're very keen that we don't end up or stop at Tamale. This time, every part of the country must be accessed. And that is why you have seen us this morning.
Now to the Upper East region. The delegation paid a visit to the Upper East region where they called on Pe-Ewia Awompaga II, the paramount chief of the Paga traditional area. Team later called on the regional minister for the Upper East region, Honorable Stephen Yakubu.
You have built a new edifice, and I've seen that you've added another one there, and I can see that you're moving on, which is great. The services that you're providing also is being modernized. As the CEO said, people were queuing, sleeping at the facilities, to make sure that they get on to be able to register. But now you can do it the comfort of your home. And that is something that I applaud you. You have not actually sat down, you have moved on. And that's the beauty of this country.
We are what we are because of the output of our staff. And why are we at health insurance? Our job is to make sure that every Ghanaian can have access to health. Educate on healthy living as well as pay for those who are sick. Honourable Minister, I believe today is the 1st of December. Mr. Udu, today is the 1st, right? And I am happy to announce that for the first time in our history as an organization, Honourable Minister, we have shifted from celebrating our week in November to now having what we call the active month or December month. Now it is rather in December that we celebrate our month. And the first celebration, the first day of December, happens to be here at the RCC. This is the first outdoor event that we've had. So December is what we call the active month. You know, Honourable Minister, what it means is that in December, we want every Ghanaian to check whether they are active on the health insurance.
Now to our final story. The delegation led by the board chair and the CEO as part of the regional tour of the Northern Belt visited some selected NHIS regional and district offices where they interacted with staff there. Here are excerpts of those engagements.
Yes, I think it's very obvious that one of the most, if not the most important organization in Ghana, it's definitely National Health Insurance Scheme, for that matter authority. If you look at the role we play, we affect every person in this country. We are not like Smith. Forgive me, I have a member from Smith here, so I'll just say that. But we are not like Smith, who will deal with you only after 60 years. Immediately, even before you are born, health insurance starts to take care of you. And in the hospital, I've seen Ghanaians or patients who come to me to try and even take care of their dead, even when people die. We talk about the 5Ds, we want to digitalize. There are a lot of things we are doing, right? Going forward, your traditional work of data entry, this, that, things will change everything. It does not mean we are going to sack anybody, but it means that you have to prepare for all of us, you and I, to work together to see what different things you can do for the organization. As the world is changing, you also want to change. So visits always help. And then tell me, if you happen to come to Accra and I see you, especially if you're a driver, I know that when I eat, you also must eat. But if we are not met, I would have eaten only to know that, Doc, the driver was here, you are not made him eat. As for Accra drivers, I know them. So most of the time, they even eat before me. If that's one of the things we are doing, some of the problems you see being solved is because your other colleagues mentioned them when we first visited, and then we started to work on them. In the past, drivers, you couldn't get your pay slips. I guess now they print them for you. Is that not the case? Yes. there was a directive that the regional HR should try and print the pay slips so that district managers can give it to the drivers if they want them. Computers, as we speak, even at the board, we had a board meeting in Tamale just this Monday. Yes, Monday. One of the issues we looked at is our procurement for computers.
This is how we wrap up this edition of NHIS in a week. For more stories, kindly visit our website on www.nhis.gov.gh and visit our social media platforms displayed on your screen. Thanks for watching.